Good afternoon. This is Group B. We are presenting endocrine examination. Contents, general inspection, thyroid examination, diabetes, and diabetic foot exam. Under general inspection, we have height. For abnormally short height, Turner syndrome, Nonan's growth hormone deficiency. If you have an abnormally tall height, acromegaly or gigantism, Klinefelter syndrome. For weight, low body weight, hyperthyroidism, high body weight, hypothyroidism, Cushing syndrome, diabetes. Body shape, Cushing's appearance, Cushing-Boyd appearance, trunk appearance, buffalo hump. Acromegaly, large hands and feet, cause features. Heart rate, if you're tachycardic, hyperthyroidism, pheochromocytoma, bradycardic, hypothyroidism. Blood pressure, raised BP, can be parathyroid or raised cortisol or raised aldosterone. Temperature, if you have a patient with warm and clammy skin, could be hyperthyroidism. If it's cold or dry skin, hypothyroidism.
Hello, I'm Dr. Mujtaba, final year student, and today I am here to inspect. Sir, can you please tell me your name? Raheel. Okay. So, can you please tell me your age?
24 years.
What's your occupation?
Student.
Oh, student. So, may I have consent to examine?
Yes, sir.
Okay. Sir, may I ask you some questions?
Yes, sir.
Okay. Sir, can you tell me what is your weight?
75.
70. Okay. I ask it because decrease in body weight indicates hypothyroidism and increase in weight indicates hypothyroidism, that is called Cushing disease, increase in cortisol hormones and diabetes. Sir, can I ask you for your height?
Exactly, I don't know.
Like some
170,
178 centimeter. Okay. I ask it for his height because abnormal and short height is a feature of Turner syndrome, and it is due to growth hormone somatotropin deficiency. And abnormal lying height is a feature of acromegaly, and it is in Klinefelter syndrome.
Okay. General inspection of face. Acromegaly presents with large jaw, coarse facial features, enlarged supraorbital ridges. Cushing's presents with plethoric moon face, raised androgens, there is hirsutism, hypothyroidism, Queen Anne's sign or sign of Hatgoki, where there is loss of outer one-third of eyebrow. These are the examples. We have acromegaly, Cushing's, Queen Anne's sign.
Okay. Sir, please look at me. Okay. We have to look at the face of the patient. The large jaw will indicate acromegaly, and the pufferness of the face and moon shape will indicate Cushing syndrome. Okay. Excess of hair on female patient face is a feature of raised androgen hormones. Loss of one-third outer part of eyebrows is called Queen's Anne sign, is a feature of hypothyroidism. Sir, can you please open your mouth? Okay. I'm looking for the dehydration. It is also sign of hypocalcemia.
Thank you.
Okay.
These are more examples where we have hirsutism in women, where there is a lot of hair on the face, and acromegaly, the large hands and large feet. General inspection of eyes in hypothyroidism or hyperthyroidism or Graves' disease, you're going to have lid lag, lid retraction, exophthalmos, and ophthalmoplegia. In pituitary mass, e.g. prolactinoma, there are visual field defects. In diabetes, there are retinal changes and xanthelasma. These are the pictures showing where we have Graves and xanthelasma.
Okay. So, sir, look at my finger. without moving your head. Okay. I have checked for lead lag or lead reduction. Then we have to see the proptosis from the back of the patient, and maybe it's not possible from there, as there are the features of hypothyroidism.
General inspection of mouth, acromegaly, we have macroglossia or wide spaced teeth. Addison's, you have gum hyperpigmentation. These are the pictures showing you. Assessing for tetany, Chossu's sign indicates hypocalcemia elicited by inflating a blood pressure cuff over the patient's systolic blood pressure for 2 to 3 minutes. Positive sign is when there is carpopedospasm in the hand and wrist. Schwartz's sign, also indicative of hypocalcemia, elicited by stimulating the facial nerve, which results in involuntary twitching of muscles. So this can't be done right now because we don't have the equipment. These are the examples. General inspection of abdomen, Cushingoid, there is truncal obesity and stria. Diabetes, there is lipohypertrophy, parathyroid, abdominal pain, hypogonadism or prolactinoma, there is gynecomastia, seen mostly in men. These are examples of Cushingoid appearance where you see the truncal obesity and the stria, and gynecomastia where you see the breasts in men. General inspection of arms and hands, Cushing syndrome, bruising and skin atrophy, acromegaly, large hands, pseudohyperparathyroidism, short fourth and fifth metacarpals, hyperthyroidism, pulmonary edema, tremor, thyroid acropathy, oncolysis. Growth hormone, there is acanthosis nigricans. These are examples.
So, sir, can you please put your hands forward like this in front of me? Okay. Sir, can you please speak something for me?
Yes. Hello, sir.
Okay. Like your name and address?
Raheel.
Okay. So, by the voice could be slow in severe hypothyroidism, and I have seen the hands for uh, for the fine tremors and sweaty hands. These are the features of hypothyroidism. Sir, can I have check your pulse, please? Okay. I have checked the pulse because in tachycardia and arterial fibrillations and thyrotoxicosis.
General inspection of legs, Quans, is weakness, cramps, reduced reflexes, hyperthyroidism, pretibial myxedema, diabetes, muscle wasting, pigmentation, and diabetic dermopathy are the presentations. These are examples of the presentations in those different. Well, we have pretibial myxedema and diabetic dermopathy. Summary of extra examinations, neurological, PTH says weakness, paresthesias, Quans, weakness, cramps, paresthesia, reduced reflexes, and tetany. In hypothyroidism, there are reduced reflexes, hyperthyroidism, proximal myopathy, pituitary mass by temporal hemaniopia, cardiovascular, hyperthyroid atrial fibrillation, diabetes, lipid dysfunction, cortisol, there is going to be raised BP. Ophthalmic, pituitary mass, visual field defects, basically by temporal hemaniopia, diabetes, the retinal changes, thyroid eye disease, impairment of eye movements. So we move on to thyroid examination. This is examined while the patient is sitting upright in a chair. In general inspection, we have the weight, the behavior and mood. Clothing, is the patient dressed too much in hot weather or dressed too little in cold weather. Hoarse voice and tremor. Inspection.
Sir, may I inspect your neck?
Yes, sir.
Okay. Just look up. Please, can you swallow for me? Okay. We have to feel the glands when it moves up and back during the swallowing. We have to auscultate to the two major lobes of thyroid gland. So, sir, can I have? Okay. If bruits are audible, then it might be the case of goiter. And if there is a large goiter, then we have to measure for the circumference of the neck.
Inspection of neck. Is the thyroid visible, diffusely enlarged or single area of enlargement or masses? Presence of scars. Ask patient to swallow and ask patient to stick out their tongue. He has already done it. So thyroid gland masses on swallowing, they are there. Tongue protrusion, they don't appear. Thyroglossocysts on swallowing are present. Tongue protrusion are there. Lymph nodes on swallowing, they are not seen, and tongue protrusion, they are not seen either. Palpation and percussion. Palpate each of the thyroid's lobes and the isthmus. Try to work from the upper edge of the thyroid to the lower border. Ask the patient to swallow to assess for symmetrical elevation. Ask the patient to protrude their tongue to feel any movement. Palpate lymph nodes. Palpate the trachea, as large goiters can cause deviation. Percuss the sternum. Retrosternal dullness may indicate a large thyroid mass extending posterior inferiorly to the manubrium. The doctor has already done it for us, so we can move on. Auscultation, audible bruit can occur in Graves' disease. Complete examination. Summarize your findings. Further investigations may include thyroid function tests, ECG, and ultrasound of the thyroid. This is picture summarizing the inspection, where you see arch rest, swallowing, palpation for a thyroid mass, and palpation for tracheal deviation. Features to assess in thyroid examination: the size, the symmetry, consistency, masses, and palpable through. Pathology: thyroid nodule or malignancy, Graves' disease, toxic multinodular goiter. Characteristics: we see asymmetry, distinct palpable mass. In Graves, diffuse goiter, palpable thrill. In toxic multinodular goiter, we see widespread irregular consistency. Then diabetes examination. General: does the patient appear well or unwell? Alertness, color of skin, weight, hydration status, breathing properly. Any scars or bruises, especially around upper thighs, abdomen, which can be secondary to insulin injections. Any equipment around or attached to the patient, e.g. insulin pens. Vision: assess visual acuity. Ask the patient to keep head still and follow your finger movement. Ophthalmoscope to assess for rubiosis, cataracts, or retinal problems in each eye. Diabetic foot exam: assess for any gross deformity of foot. Assess gait of patient, commonly bird stance or high stepping. Inspection: assess for cyanosis, arterial or venous ulcers, gangrene, missing limbs, toes or fingers, scars, hair loss, calluses, venous grafting, muscle wasting and atrophy, pigmentation. This is an example of diabetic foot. Palpation, temperature for both legs, pulses posterior tibialis and dorsalis pedis. Feel for any bony deformity, potential for Charcot striae. Neurological assessment of food, check for any changes in sensation, soft touch using the monofilament, vibration, tuning fork, assess reflexes such as the ankle jack, and assess power, proprioception. This is the monofilament test, and it cannot be done because you don't have the equipment. Tuning fork test, so that one. Completing the examination, further investigations may include HbA1c and peripheral vascular exam. That's the end of endocrine.
So the summary of the patient is that today I have examined Dr. Raheel Ahmed, age of 24. On general examination, there was no tremors of the head, no specific markers of thyroid disease, no evidence of thyroid eye disease, no goiter, no peritibial edema, no pufferness of face. And for more specific investigation, I would like to do urinalysis and CBC to check specially for TSH, T3 and T4. Thank you.